Hi everyone, this is Margie coming from Immune 8. I'm going to talk to you today a little bit about multiple sclerosis. It's Awareness Month, and I'd like to just explain to you what the disease is. It's an autoimmune disease where the immune system attacks the body of the person, good cells, for apparently no reason. Doctors and scientists really don't know why it happens or how it happens. It just happens. And it hits more women than men. And it also hits the people between the ages of 20 and 40. And I think that's very, very young. Multiple sclerosis hits the central nervous system. So what the immune system does, it attacks the myelin tissue that covers the nervous system. So then the nerve impulses react, and they're not covered or they're not conveyed in the same line as a normal nerve communication would be. So I just wanted to let you know about that some of the symptoms of MS would be muscular weakness, often in the hands and the feet, tingling and burning sensations, numbness, chronic pain, coordination and balance problems, fatigue, vision problems, and difficulty with bladder control. I know some people, they go and they opt to have the surgery to have their bladder tacked back up and tacked in, so they will have some sort of control over the movement. People with MS also are fatigued. They have trouble thinking thoughts, and they also deal with depression. One of the things that I am doing is looking at the different characteristics of chronic disease. And chronic disease, no matter what it is, that has the same characteristics. And I mentioned this before, I believe, and that's depression, that's coping, that's isolation. They feel isolated. They have a hard time communicating what they're feeling and thinking because of the stress and the distress of the disease. Family members are very important. The support group is very important. And so I just wanted to tell you tonight about what MS is. And I will be going over some of the alternative therapies that can help MS. So some of those are yoga, tai chi, acupuncture, and reflexology. So I will be going through some of the research that has come out on whatever complementary therapies that have been doing success with this. They really haven't, which is the National Institute of Health, has not said anything about supplements, that certain supplements work and certain supplements don't. I myself, I am trying to, with my essential oil products, I'm trying to create an essential oil that may help with some of these characteristics of the disease. And I'm really hoping that it does. And even if it just gives them a little bit of moment of peace to where they can sleep better, because sleep, again, it's rejuvenation and regeneration when we sleep. So when you get a good night's sleep, when you're not feeling good, you're feeling so much better the next day. So the more times that you can have good sleep, then the coping mechanisms of MS or any chronic disease is better. So anyway, I just wanted to get back with you and discuss what MS is, and then I'll be discussing different alternative therapies. Thank you and have a great night. Thanks for joining me.